Hey guys, we're going to jump right in today on a mechanistic versus vitalistic view of healthcare. We really live under the umbrella largely globally under a mechanistic view of healthcare, and I wanted to define that versus the paradigm that I keep talking about. Mechanistic view of healthcare is really that it takes the body and it looks almost like the body is a machine. You've got separate parts. And it's basically the summation therein, right? Your body or your health is a sum of these different parts working together. What I mean by that is you have your cardiologist, your endocrinologist, your pulmonologist, your gastroenterologist, right? You have all these specialists that take little pieces of the body and they try to do their best to make that single function work better, but nobody ever really brings this all together and brings it in on the whole, okay? It's very symptom focused, like if it hurts here, problems here. Very health comes from the outside in, that you need to take drugs, surgery, or whatever meds to make you healthy, alter the chemistry within the body, alter the immune response, right? It's very focused on suiting the environment to meet the weakened body, okay? So change your environment, weaken body. Masks, gloves, social distancing, okay? Very, very, very much based within the germ theory. Germ theory is, you get a bug, it gets out into society, it's going to sweep across society, and we're all doomed, okay? That's in a veil, mechanistic view of healthcare. So flip that on its head. Vitalistic is the opposite ultimately, literally the opposite. So vitalistic looks at the body as a whole, right? It's a holistic approach to healthcare. That healing comes from above, down, inside out. That the body's self-healing, self-regulating. It knows what to do. You've got the wisdom within you, the doctor within you is what stitches your finger together if you cut it. That's what mends the bone, right? There's intelligence and wisdom within there, and we just acknowledge that. It's not symptom focused. Symptoms guide us, right, to what may be the cause of the issue. And if you go back to embryology, right, basic embryology, the very first organ system to ever develop is your brain and central nervous system. In an embryo, we call it the notochord, okay? And what's cool about that is it literally governs and determines the differentiation of the cells as you develop and grow. It coordinates everything from the time you were an embryo to now. So why, as a holistic chiropractor, do I go to the spine? What better portal of entry do we have to the central nervous system than that? Right? It's the absolute best access that we have to influencing the body on the whole. That's your wiring. Okay. So we take that to today and all the madness that's going on out there, and it's pretty wild because I look at that view and through my eyes over the years, I've looked at this and just think like, at what point do you own your results? Like seriously, at what point do you have to suck bad enough to wake people up to say, this isn't working for us? And here's what I mean. Strong words, I know. But we're the sickest industrialized nation in the world. We have the most chronic disease in the world. I made a post the other day that, making this related to the COVID thing, the United States makes up 4% of the global population, and yet we have almost a third of the global deaths. So either our healthcare system is so inept, or these numbers are being totally fudged. You take your pick, and I think it's probably a little bit of both, okay? Because the reality is we have the sickest kids. We have the most cancer in kids. We have the most autism. We have the most neurodegenerative diseases. We're the sickest industrialized nation in the world. You start asking, this mechanistic view of healthcare, and they're saying, oh, it's the food industry. And then the food industry says, no, it's drugs and the pharmaceutical companies. The fact is they're owned by the same people. So you got to wake up and say, like, you know what? I don't think I'm going to follow that anymore. Because honestly, how low are your standards? I do a lot of vitamin D testing within the body or within the office. Within the body, we check vitamin D levels. I have people that come back to me all the time and they're like, oh, my doctor checked my vitamin D and he said it was fine. Their standard is that your blood serum level should be 30. That just means you're not dead. It should be 63 or 64, right? So they literally, their standard is so low, it's half of what it actually should be in a holistic, vitalistic view of health. Again, guys, it's like, how many of our kids do we have to see get sick? How many of our loved ones do we have to watch get sick and die? How many people, and this isn't just a coronavirus thing. This is just like a wake up. This is the sickest nation on the planet. When are we going to wake up and say, you know, this direction of healthcare isn't working? And you know what's crazy is right now that's happening. I think COVID's actually been a really good thing because there's a lot of medical doctors that are waking up to this reality that, hey, we're treating this thing completely the opposite direction of what we should be doing. And it's not just coronavirus, it's all this other crap too. And the thing is, when that mechanistic view turns into a governing body, they start threatening them and myself with our licenses and say, you're going to do it this way or else we'll steal your license away from you, right? Well, until somebody comes and pays for my student loans, which was like $120,000 plus, right? I'm going to look at this and say, hey, I paid for my education. I invested in myself to be able to think for myself clinically on the science that I learned. And when I look at the science that I learned and compare it to what's going on clinically, it's absolute utter madness. Okay? So I'm really proud of the medical doctors that are out there right now speaking up and saying like, hey, we've been wrong. We've been doing this the wrong way. And they're thinking differently, and it's going to change healthcare ultimately. But we've got to get some sick people out of power first, okay? What I'm talking about, Fauci is coming forth and saying 2.2 million of you are going to die, and then, 6 weeks later says, well, maybe more like 60,000. The CDC says, 68,000 people have died from coronavirus, and then the very next day they'd lower that to 39,000. Like, who's going to tell you the truth anymore? Nobody's coming to save you unless you go and change your view on things and start taking some leadership from other people. So what I'm saying is that's why I'm standing here yakking at you. Like, I'm here. This is what we do. You've got medical doctors in town that are saying run for the hills. You're going to die, right? Because they bought into this mechanistic view of healthcare. Or you can follow the voice that's saying, look, you are fearfully and wonderfully made. God didn't make any mistakes when he put you together. You are healthy by design. Health is your birthright. We just have to unleash that, right? We've got to set it free. We've got to get you good nutrition. You got to get adjusted. You have to have a well-functioning nervous system. Otherwise, you're going to be alphabet soup, right? You're going to be into the rest of the mix with all the rest of the sick people. Anyways, just wanted to touch on that. I know I got a little fired up about that, but you're going to see a lot more of me over the next couple of months. We're going full offense. I've been quiet long enough. I've bit holes through my lips. People are suffering. It's unacceptable. I'm not going to stand here quiet anymore and watch our kids get sick, watch our families fall apart in that way. Like, not going to happen on my watch any longer. So buckle up, baby. Here we come. Have a good one. Talk to you next time.